Hello friends, I am Dr. Anand Utture, Consultant Urologist and Laser Specialist of Raheja Group of Hospital. Today we are going to discuss about the difference between a cancer prostate and benign enlargement of prostate. Benign enlargement of prostate is a prostatic enlargement which is not cancerous, and as the word says cancer prostate, we are talking about the cancer prostate. Why it is very important to know about the difference is because after age of 50, it is the commonest cancer which is there in the body, and the treatment option for both are completely different. So whenever anybody achieves that age of 55, he requires to go to a urologist to evaluate him so that we come to know whether there is a cancer or non-cancerous thing. Why a prostate becomes a cancerous thing? It is completely dependent upon the DNA, which are controlled by your inheritance and many times because of age-related things. So any prostate can go into a cancerous phase, and this can be picked up by doing early investigations. Now, unfortunately, the symptoms for both the prostate enlargement as well as the cancer prostate are same. They can be urgency, increased frequency, nocturia or getting up at night to pass urine, incomplete evacuation of urination, decreased stream, and sometimes you feel like not passed urine completely and bladder remaining incompletely full even after passing of urine. But there are very specific symptoms which are there with cancer prostate, which cannot be neglected. It can be, sometimes there is a possibility of bleeding that can happen, which is called as hematuria. There is a possibility of blood coming in your semen, that's called as hematospermia. There can be weight loss, constipation, and loss of energy levels. These are the things, if it happens, then you have to strongly have a suspicion that it could be a possibility of cancer prostate. Whenever this kind of patient come to us, we evaluate them by doing a per-rectal examination. Per-rectal examination shows us whether the prostate is enlarged, whether it is nodular or it has got hardness. The characteristic of cancer prostate, it becomes hard and it has got a nodularity. Then we do a test which is called as PSA test. It is one of the most sensitive and most important tests which is there, which tells us whether we are in a prostate enlargement zone because of BPH or in cancer. More than 4 is usually suspicious of having a cancer prostate. In between 4 and 10, we call it as an intermediate zone, and we always evaluate by doing a free PSA. The free upon total PSA is evaluated, and depending upon that, we decide whether the patient will require biopsy or patient will have to be taking a treatment for benign prostatic enlargement. One of the newer things which are come into vogue is something called as MRI multiparametric studies, which tells us the PI-RADS scoring of the prostate gland. If it is 1 and 2, it is usually goes in favor of non-cancerous lesion. PI-RADS score 3 is equivocal, and 4 and 5 usually is cancerous. If it is showing that the PI-RADS score is very high, there is a nodularity and PSA is also high, we go and we subject the patient for transrectal ultrasound and the biopsy. If the biopsy comes positive, we do a PSMA PET scan, which tells us whether the cancer is within the prostate gland or it is spread to the outside. Now, treatment option, most of the patients with BPH, enlarged prostate, can be treated with medical line of treatment. This can be alpha blockers or 5-alpha reductase inhibitors, depending upon the size of the prostate. When we start these alpha blockers and 5-alpha reductase inhibitors, initially we come to know that the patient can be managed with medical line of treatment. Medical line of treatment failing with, we go for surgery, which is TRP, bipolar TRP or holmium prostatectomy. In case of cancer prostate, if it's an early stage, we do radical prostatectomy or radiation therapy. If the prostate cancer is gone beyond the prostate, then we do metastatic cancer prostate, which is bilateral orchectomy, GnRH analogs or chemotherapy are the treatment options. One of the newer things which are coming into vogue is cryotherapy and HIFU, so that we come to know that what exactly can be managed for cancer prostate. One of the most important thing everybody has to evaluate and understand that the cancer survival for 5 years is 97%, provided that we pick up this cancer very quickly and we give the treatment as quickly as possible. Thank you.